Can risperidone treat anxiety? Have you ever wondered if a medication used for schizophrenia could also help with anxiety? Today, we will look into risperidone, also known as Risperdal, and its role in treating anxiety. Risperidone is primarily an atypical antipsychotic medication. It is mainly prescribed for schizophrenia, bipolar disorder, and irritability associated with autism spectrum disorder. This medication works by balancing dopamine and serotonin levels in the brain. These neurotransmitters play a key role in regulating mood, behavior, and thought processes. While risperidone is not specifically approved for treating anxiety disorders, it can sometimes be used off-label for anxiety-related symptoms. This means that doctors may prescribe it for anxiety even though it is not its main purpose. In the context of schizophrenia treatment, risperidone helps manage symptoms such as hallucinations, delusions, and disorganized thinking. These symptoms can sometimes lead to anxiety or worsen existing anxiety. By controlling the core symptoms of schizophrenia, risperidone may indirectly help reduce anxiety in some patients. However, when it comes to anxiety as a primary condition, risperidone is not usually the first choice. Other medications, like antidepressants or anxiolytics, are typically preferred for treating anxiety disorders. That said, in certain cases where anxiety is severe or linked to other psychiatric disorders, risperidone can be combined with antidepressants. This combination may help address symptoms like agitation and irritability, which can accompany anxiety in conditions such as bipolar disorder or depression. Risperidone may also be used for anxiety-related agitation in patients with dementia or other neuropsychiatric conditions. It is important to note that any anxiety relief from risperidone is usually secondary to its effects on psychotic symptoms or mood stabilization. For patients with schizophrenia, managing psychotic symptoms can lead to a decrease in anxiety that arises from those symptoms. If you or someone you know is considering risperidone for anxiety, it is essential to consult with a healthcare provider. They can provide guidance on the best treatment options based on individual needs. Stopping or altering risperidone treatment without professional advice can worsen symptoms, including anxiety. In summary, while risperidone is not primarily used to treat anxiety, it may provide some relief in specific situations, particularly when anxiety is linked to other mental health conditions.